The theme of Wellspring is wisdom within. Wellspring Heart is a perfect example. Nearly 2,400 Americans die each day of cardiovascular disease. That's one person every 37 seconds.
Heart disease causes more death in our country and in fact in the world than any other disease.
Cardiovascular disease is a very expensive disease. It costs the United States about $475 billion a year.
The scary thing about it is that it often does it without any symptoms beforehand. In fact, fully 50% of people who have heart disease find out about it when they have a heart attack.
According to the landmark InterHeart study, 90% of the risk of your first heart attack is based on risk factors that are easily detected and easily prevented.
That's why I'm such an advocate of early diagnosis, because 70% of men over 50 have heart disease if we look at them carefully enough. 70% of women over 60 have heart disease if we look at them carefully enough, and carefully enough is with CT angiography.
Unfortunately, we eat too much, do too little exercise, have too much stress in our lives, in addition to having high blood pressure, being overweight, and those types of cardiovascular risk factors are what lay down the initial fatty streaks that cause atherosclerosis or the hardening or development of heart disease.
Unfortunately, all of us are at risk for heart disease, some more than others, and we all have heard endlessly about those risk factors of your family history and your gender, your age, whether you smoke or not, what your blood pressure is, what your cholesterol level is, how active you are, whether you're under a lot of stress. All of those things add to the risk in fairly predictable ways.
The old blame it on your genes or genetic makeup just doesn't cut it anymore. I think people are really surprised at how quickly they feel better. I think that's mostly because of the combination of the four components: the exercise, the stress management, the group support, and the nutrition.
Likewise, we've seen large drops in perceived stress, right around 50% on the psychometric tests that we do. Again, that's what we would hope to see, and probably really hope to see, if people started medication for their anxiety. And we know that that stress level, that perceived stress, is a huge risk factor in the development of coronary disease, and as important as diet and exercise and group support are, stress reduction is equally important in terms of getting us to reversing the heart disease. We see huge improvements in people's psychological profiles, and we measure depression, hostility, and perceived stress both before and after the program. Depression, for instance, goes down in the first 3 months 64%, an incredible drop. We would hope to see that if we put somebody on an antidepressant, but this is in the absence of adding medications to folks. The vitality outcomes are sort of side effects, I think, of this program. Unlike medications that almost always have bad side effects, this program has salutary side effects. For instance, people lose weight. It's not a weight loss program, but our average weight loss over the 1-year period has been 22 pounds, and actually more than that for people who had more weight to lose. People have lots of increase in their exercise capacity as well, about a 30% increase, which we measure on the treadmill. All those numbers get better too. They're sort of abstract things in a way, but very satisfying to see a 20% drop in cholesterol levels and significant drops in blood pressure. And the side effect that engenders is that people end up taking a lot less medication after they do this program than they did before. The bottom line is that you're much less likely to have a heart attack after you do the lifestyle change program than if you do conventional care and take the usual medications.
The Wellspring Heart program is a revolutionary approach to heart disease to both prevent and reverse it. It's made up of 4 components: exercise, stress management, nutrition, and group support. Each component is equally important, and they all build upon each other. There's 2 different programs that we offer at Wellspring. One is an intensive week-long immersion. They spend 7 days and 7 nights at the Oregon Resort, and they also spend half their time here at Wellspring. And it's an incredible hands-on approach, immersive approach to the Wellspring Heart program. We also have a 12-week on-site program that intervention time is spread out over the course of 12 weeks, 96 hours of contact time twice a week. Although Wellspring Heart is a group program, we really care about the individual, and we try to make each person feel like this program is just for them and that it's meeting their needs and their desires.
We look at people pretty darn carefully when they enroll in the heart program. We do all the usual laboratory screening, but in addition to that, we put people on a treadmill and do a study there to define exactly what their exercise capacity is, so that when we write an exercise prescription for people, it is individualized just to them. We also do a CT angiogram, whereby we're able to look at the details of their coronary arteries, make sure that there's not any dangerous narrowing, and diagnose whether they have soft plaque in their arteries, which has the potential for leaking through and causing heart attacks.
One of the reasons why I think this program is so effective is because of the team approach the professionals have towards it. The exercise physiologist, dietitian, nurse, physician, stress management specialist, and group support leader do an incredible job of taking a both individual and group approach to the treatment of cardiovascular disease. The nutrition in this program is based on a low-fat, plant-based diet. What we try to do is take out all of the risks that are included in nutrition. That includes cholesterol and saturated fat, and making sure that we have an eating plan that's full of fiber, the things that we know are really good for health and for the prevention and reversal of heart disease.
My job is really to be able to coach and guide people through the nutrition guidelines of the program, to identify what barriers they may have to overcoming them, and then to be able really to get them excited about their own nutrition and move them in that direction.
Exercise is one of the easiest things that people can do to reverse their heart disease, just by becoming a little bit more active, by moving from being a couch potato to being active is what has the most health benefits for exercise.
We recommend that participants get 3 to 5 hours of aerobic exercise weekly, and in addition to that, they need 2 to 3 sessions of strength training or resistance training as well.
Stress reduction is what most people don't even think about. We think that we have stress on a day-to-day basis, and that's life.
Well, stress is a major risk factor when it comes to chronic disease, and especially heart disease. So managing stress is a great strategy in this lifestyle modification program. So there's 5 tools to stress management as part of this program: gentle stretching, extended relaxation, breath awareness, meditation, and healing imagery.
We've been finding through regular research that when we do have a sense of isolation, a sense of not having somebody there when something goes wrong, somebody that we can call and talk to, that there's a higher incidence of both heart disease and other types of chronic disease.
The tools they learn in group are absolutely transferable to family, to friends, to the various communities they are already part of. Wherever their home is, they can take these skills and continue to build their social connectedness, reduce their isolation. It's that isolation and adherence.
We think that friends and family support is one of the most important things as far as people trying to make big lifestyle changes. So we actually encourage the spouse to participate if they can. If for some reason, due to time or financial constraints, that's not possible, we invite the spouse to, or significant other, or even family member, to come and join us for the educational parts of the program, so that there is that support at home. We also do periodic special sessions for the family if they would like to learn a little bit more about certain parts of the program. There's a couple important aspects to our long-term follow-up. One is we have nurses and other allied health professionals that act in a care guide role. And that care guide is to sort of be the glue of the whole program. They monitor sort of the overarching aspects of the program, and they are their connection to everybody else in the program. We also have an online community where people can connect to their own individual groups. We call them cohorts, or even to the larger, or to the group at large. They also can find out the latest recipes that our dietitians want to post, tips by the group support and stress management specialist, as well as ways to enhance their new exercise program. I think our participants really feel cared for, and I think that's because we really want to know that person and connect to that person. So as much as we really want them to develop their own community, we hope that they see us as part of their community as well.
The technology they use to help you just understand what's going on in your own heart is worth the price of admission. I mean, wouldn't you want to know?
I wish everyone would have this be have the gift themselves with this kind of experience, because it's an incredible way to live.
I would say to anybody considering it, expect it to be a pleasant, exciting, worthwhile program.
When they say you gain 15 years of your life, they didn't tell me that it was the energy level and that you feel younger than you did 15 years ago.
It's not a fad, it's a lifestyle change. And a lot of programs say we're lifestyle changes, but this is truly a lifestyle change. You'll never be the same once you go through it.